Good afternoon. I'm Annette Vanderveer. I'm with the Human Services Department of DeKalb County. Welcome to our Lunch and Learn series today. We're very excited to bring you a fabulous speaker that's going to tell you all about Claratel. Before I introduce him, please remember to put your questions in the Q&A. This is a webinar, and we will be able to read your questions. However, you cannot put them in the chat because, of course, it's disabled. Now, let me introduce our speaker today. His name is Mr. Fabio van der Merwe. He started his career with Claratel Behavioral Health in 2006 and has served in management positions in the departments of compliance, quality, and utilization management. In 2016, he joined Claratel's Behavioral Health leadership team as the Chief Operating Officer, and in June 2020, he was appointed to his current position as their Chief Operating Officer. Prior to his work with Claratel Behavioral Health, Fabio held positions in managed care, substance abuse, and other behavioral health organizations. He has a BA in psychology from Emory University, an MA in clinical psychology from the University of Maryland, Baltimore County, and certification in healthcare compliance. Please welcome Fabio van der Merwe. The floor is yours.
Thank you. Thank you very much, and I appreciate that introduction and for this opportunity to talk about our organization. So I'm going to go ahead and share my screen. So I'm here. I'm the current CEO of Claratel Behavioral Health. People may have formerly known us as DeKalb Community Service Board. So last year, we rebranded and changed our name to Claratel Behavioral Health. A lot of staff of people in the community asked, well, why did you change your name? Well, not many people knew what a community service board is and what does that mean. And a lot of people did not know we actually provided behavioral health and substance use and intellectual developmental disability services. So we wanted to have a name that kind of reflected more about what we provided. And then the next question is, what does Claratel mean, or what is Claratel? So Claratel is actually made up of two Latin words, Clara, which means bright or clear, and hotel, which is the word for a place of wellness. So our name means a bright or clear place of wellness, which we think kind of reflects what our organization is attempting to do in terms of supporting our clients. So as I mentioned, formerly DeKalb Community Service Board, we are technically we're a public nonprofit. So we're considered a governmental entity. We're somewhat similar to the board, the DeKalb Public Health organization, where we're actually created by state legislature to serve the public. But we operate as a nonprofit. So we kind of have a dual relationship with being a governmental entity, but are considered and operate as such as a nonprofit, a little bit and independent of the state. Our mission is to provide the right service for the right person at the right time. And we envision a community where disabilities no longer limit possibilities. So just a brief overview, and I'm going to go into a little bit more detail about our organization. So our organization is about a $44 million organization. We have about 420 employees, ranging from psychiatrists, nurses, licensed clinical social workers, licensed clinical professionals. We also have case managers, our direct service professionals, and administrative staff. So we have a wide range of staff, all different levels and all different clinical backgrounds. We have multiple locations surrounding DeKalb County, different clinics. I'm going to talk a little bit more about each of these. And also, we, as a community service board, as is kind of serving as the public community service board, our role is to provide the full range of services. So in terms of a higher level, we operate the DeKalb Regional Crisis Center all the way to outpatient and residential services. So that is a mandate by the state, is that we provide the full range of services. So this is just some of those different types of services we provide. I'll talk a little bit more about that as we go on. And you can see from the map kind of where our different clinics are located. And many of the facilities that we're in, we also share with DeKalb Public Health. So who do we serve? So our priority is serving individuals with no insurance. So anywhere between 50 to 60% of all the clients we serve have no insurance. We serve individuals with Medicaid, and we serve individuals who may have insurance, but they've exhausted their mental health benefits. So there are some insurance plans out there where they may only give you 8 sessions or 8 visits. Once those are exhausted, we can then also serve those individuals. In terms of requirements, we have requirements that are kind of given to us by the state. One of those main requirements is that individuals we serve in our outpatient clinics who are adults must have lawful presence. So they must have some verification that they're here lawfully. We can see, we don't require that for children. This is only for adults in our outpatient clinic. And there is a sliding scale based on income. But I'll tell you now, about 98% of our individuals without insurance pay nothing for their services. So a large percentage of our individuals do not actually pay anything for their services. And also we cover medication as well. So a lot of the medications we may prescribe, we'll also cover as part of the services we provide to the community. So talked a little bit about outpatient services. So we have 4 primary outpatient clinics. One of them is in Clifton Springs. One of them is on Winway. We have one in Kirkwood, and then we have one in North DeKalb. And we also are working on getting our clinic opened up in East DeKalb. In 2024, we provided about over 44,000 individual services just in 4 of these clinics alone, and served about 2,652 unique individuals just at these clinics and just for outpatient services. So what do we mean by outpatient services? Well, we provide in these clinics individual group counseling. We provide community-based case management. So we have a case manager that is assigned to individuals who will go out in the community and work with them out in the community. We have a peer support program and peer support staff. Physician services. So we do have psychiatrists on staff, on site, that provide psychiatric services. We have nursing services, as well as a dietitian who can work with our clients. And then we have psychosocial rehab, which is a rehabilitation program for individuals suffering from severe persistent mental illness. We also have supportive employment. 3 of our sites, we have an actual full pharmacy. So if you so you can get your medications on site, so you can see the psychiatrist, walk out the door and get your meds before you even leave the building. And those pharmacies are fully functional, so they also can provide medical medication as well. And then we do assessment and treatment planning, and then telehealth. So right now at this around at this time, about 40% of all the services we provide in outpatient are through telehealth. So that's a really good option for some of our clients who may not be able to travel to a clinic, or it takes them too long to get there. That we can also provide telehealth services for majority of our services that we provide to them. In terms of accessing our services, generally we have a central access number, which I'll show at the end of the slide. Clients can call that number. They'll be asked a series of questions, just basic triage questions. And this is really to determine, is this an emergency, or is this something that we can address in our outpatient clinic? That individual is generally given an appointment the next day, where they'll come into one of the clinics that is close to them and for their intake. When a client shows up for an intake, They'll be briefly assessed by our front desk to collect kind of basic information, sign the releases for services, the privacy practice notice, provide information regarding income so we can calculate the sliding scale fee, and then they will see a licensed clinician for an assessment and evaluation. And during that assessment evaluation, the therapist will work with the client to determine what are the other additional services that they may need. So do they need supportive employment? Do they need case management? Do they need to see the psychiatrist? Do they need to see the nurse? So they'll work with the client to kind of decide what that treatment plan should look like, and then we'll work on scheduling those other appointments. We generally can get our clients to see a psychiatrist within 14 days from their intake appointment. So that's about, right now we're running around 75% of our clients get to see a psychiatrist within a 14-day period. That's our goal, is to have it closer to 90%, but that is a really good percentage to see a psychiatrist if you need medication. And then after that, the clients engage in our services, and they can always get additional services if need be by talking with their clinician. And just some data. So this is looking at 2024 for outpatient clinics. You can see there the number of services, the total number of billable hours, clients served, a number of providers in our outpatient sites. About 50% of our clients are what we call state contract, which means they have no insurance. And about a quarter of the individuals have Medicaid. Most of the clients we see in outpatient, about 45% have a mood disorder. Then about 30% have some psychotic disorder. So we're working with individuals with severe and persistent mental illness in our outpatient clinics. The service we provide the most of is individual psychotherapy, followed by case management out in the community, and then with psychiatric physician services. So we're really focusing on those kind of core services for individuals. And the bottom graph just shows you the types of programs and the services provided at each. Our Winway Clinic is one of our busiest sites, as well as our Clifton Springs sites. And then Kirkwood and North are somewhat of our smaller locations. Moving on to our intellectual developmental disability services, we do have 2 locations where we provide services for individuals with IDD. At these locations, we provide community integration services, community access group services. We also have 9 homes that we operate for residential services. So we actually provide residential service to these clients, and also manage about 8 host homes as well. So we're doing both residential, group services, community-based services. So we work with our individuals out in the community, as well as providing supportive employment. We also do, our clients also receive behavioral health services. So we're one of the very few providers where an individual can get both IDD services and behavioral health all in one location. And just last week, our organization received NAD certification, which is National Association of Dual Diagnosis, which recognizes organizations that provide both behavioral health and intellectual developmental disability services, or co-occurring services for clients with a co-occurring diagnosis. We also do transportation. So we actually have a fleet of about 76 vans that our organization operates that helps also provide transportation for both some of our behavioral health programs, as well as our IDD programs, just to make sure clients can get to their services. We only do it for those programs. Outpatient is the one program we still don't provide transportation for, but I think we're looking at expanding in that area. Child and adolescent services. So about 20% of all the clients we see are children. So we have about 1,389 kids. With children, we provide comprehensive evaluations, emerging adult support services. We also provide school-based mental health services. So we're in about 17 schools in DeKalb County, where we provide on-site mental health services to children in the schools. And then we also have a parent peer support program and to help parents, and a youth peer support program to help children. And during the summer, we want to make sure that our clients who are in our school-based programs maintain the gains that they've had throughout the year. So we do a summer program that is staffed with our therapists and case managers, where we do special activities, outings. So it's a really good 3-week program to kind of help maintain the gains the individuals may have during the school year. Residential and housing support. So this is another component of services we provide. We actually have about 75 apartments in DeKalb County that will provide housing to individuals who meet the HUD definition for homelessness, as well as having a severe and persistent mental illness. So they have to have some mental health diagnoses for us to be able to serve them. We operate some of these beds through the DeKalb County COC, and then some of the beds are operated through our grant with Department of Behavioral Health and Developmental Disabilities. Housing support program, that supports individuals with housing vouchers, where we actually provide case management services to help individuals maintain their housing. So we'll have case managers go out for individuals who have a housing voucher and work with them to maintain their housing in the community. And DeKalb Regional Crisis Center. So our DeKalb Regional Crisis Center provides short-term care for people experiencing mental health or substance use crises. The goal here is to stabilize individuals and quickly refer them to community resources. So our crisis center actually has 3 components to it. It has a crisis evaluation component, temporary observation, and then the crisis stabilization unit. The crisis evaluation is where individuals will first be evaluated to determine what's their level of crises. Is there something that they can be stabilized within a 23-hour period? Can we refer them to outpatient, or do we need to admit them into our crisis center? That generally can take about 6 hours in terms of assessments, evaluations to determine that. And then we have our temporary observation unit, which is about 6 beds. That is for individuals who may not need a full multi-day stay to be stabilized, but can be stabilized in 23 hours, or they are individuals waiting for our crisis stabilization bed. And then our crisis stabilization unit currently is operating at 24 beds. We can go up to 36 beds. And those are individuals who may need longer-term crisis or detox stabilization. So we also do substance use detox at the crisis center. Generally, our length of stay at the CSU is about 5 days. This crisis center, although it's not the biggest crisis center in the state, it is the largest bed capacity of being able to go up to 36. It is also the busiest crisis center in the state. So there's actually quite a few different crisis centers. There's 9 what we call behavioral health crisis centers, which is how we define the DeKalb Regional Crisis Center. Our daily admissions to this crisis center is double the state average of all of the other crisis centers. And we're also one of the only 4 emergency receiving facilities in Metro Atlanta. What is an emergency receiving facility? Most people don't realize that in order for a facility to hold someone involuntarily, so let's say there is what we call a 1013 order, or a order to apprehend through the probate court, individuals under those orders can only go to emergency receiving facilities to receive an evaluation. So they can't go to an ER, They can't go to emergency room department. They're limited to where they can receive that emergency evaluation. And we're one of the four in the Metro Atlanta. The other ones are Grady, the Fulton County Crisis Center that just recently opened up, and the State Hospital on Panthersville Road. And this just is a kind of a picture of the clients that we served in 2024. So we had about 4,265 visits to our crisis center in 2024. That's about 2,900 unique patients. So we do get a lot of clients who come back to our services throughout the year. We served about 923 homeless individuals. That's unique individuals. 59% of that population indicated they originated in DeKalb County. So about 41% of the individuals who are unhoused that we served at our crisis center came from outside the county. So that is a significantly large number of individuals who are experiencing homelessness. Most of our clients are walk-ins, so our crisis center is open 24/7. You can just walk into the building to receive services, but we also then get individuals with the sheriff's department, police departments, non-emergency medical transports, and our co-responder program that we operate with DeKalb County PD, Decatur PD, Doraville, and Dunwoody Police Departments. And that co-responder program is where we pair a case manager or a licensed clinician to work with that police officer. They get called out on mental health calls out in the community. And if need be, they can bring individuals to our crisis center. About 60% of the individuals that we see at our crisis center have no insurance. And generally, we're one of the only places that people can go to receive crisis stabilization or detox services without insurance. And on the right, you can see primary reasons for visits: mood disorders, psychotic disorders, alcohol-related disorders, cannabis and cocaine are generally substance uses. And then we also have about 5% of the individuals we serve have an opioid use disorder for detox. So you can see a combination of both mental health needs and substance use needs. And we also serve co-occurring. And I just want to show you kind of a comparison of our crisis center to other behavioral health crisis centers in the state. So on the left, you can see all of the 9 behavioral health crisis centers that are in the state and the CSBs that operate them. And you can see Claratel, that's our DeKalb Regional Crisis Center. That's average daily admissions of 9, where most of the other facilities are at 5 or 4. And then in terms of admission sources, you can see just how many admissions we've had over a 6-month period to compare to some of the other behavioral health crisis centers. In fact, our number of admissions is 70% higher than the next highest behavioral health crisis center in terms of number of admissions. We actually, our crisis center accounts for about 44% of all OTAs that are served in amongst all of the other behavioral health crisis centers, and we account for about 25% of the 1013s. So extremely busy center. And that is why we're looking at hopefully building a brand new crisis center to expand our capacity. This is definitely something our community needs for us to grow. This new crisis center, we're looking at having at least 20 temporary observation beds. So right now we have about 6. So we're looking at going up to 20 and about 30 crisis stabilization beds that we can support individuals who need mental health crisis stabilization. And then something that would be unique for our crisis center, 24 mental health transitional beds. And really why we're looking at adding these transitional beds is because per the state, we can only keep individual at our crisis center for about 7 days. And sometimes that's maybe not enough to fully stabilize someone or get them connected to resources. So we're looking at adding some transitional housing beds where we can stabilize someone, move them into transitional beds, and then continue to provide treatment to them as we work on getting them reconnected back into the community. So important things, how do you access services? So on the outpatient side, we have our central access number, 404-892-4646. That number is available during office hours. Individuals can call that number. As I said before, they'll be asked a series of questions, and then they'll be set up with an intake appointment at the clinic that is closest to them. And then we have our DeKalb Regional Crisis Center. So this is for individuals who are in crises, who need immediate care. You can walk in. The address is 451 Way, so anyone can walk into the crisis center and receive services. And then the number for the crisis center is 404-294-0499. But if it is an emergency, and we definitely would recommend that you call 911. If it's an immediate emergency, you can ask for the mobile crisis team, and the dispatcher is able to dispatch a our mental health co-responder team through the mobile crisis team to the location. There's also 988, which is for individuals that may be having a mental health crisis, and 988 can also refer individuals to either our outpatient clinics or to our crisis center. I know I went through that pretty quickly. We still have, so I wanted to make sure we had a lot of time for questions and any other that you may have of me or any thoughts about our services.
Okay, I just wanted to add, one of the questions came in about, do you see parents and families without insurance? And I believe you did answer that and say, yes, you do.
Yes, so we do see families, provide family therapy as well. So we'll see the whole family. Anyone, as I said, our primary focus is individuals without insurance. That's really kind of where we try to focus our services. And as I said, a majority of our individuals don't pay for the services based on the sliding scale fee. So it's a very generous sliding scale fee in terms of covering the services and covering the medication.
Okay. Audience, do you have other questions? I don't see any more questions. So if there's anything you'd like to add in terms of how to get in touch with you, or
Well,
are there specific questions?
yeah.
Okay.
So if you have questions for me as a CEO, my email address is FABIO, V as in Victor, @claratel.org. You can feel free to reach out to me, send me an email. We have existed in this community in some version for about 50 years. So we were only created as a community service board back in the early 90s. So we have been here for a very long time as an organization. And our sole goal is to serve DeKalb County. That is what we're here to do, and provide that mental health and substance use and intellectual and developmental disability services to the community, to make sure that individuals in DeKalb County can have meaningful lives. Now, I say we're DeKalb County focused, but we do serve people outside of the county. So anyone can come to our clinics. We get a lot of individuals coming from Clayton County, from Gwinnett, from Fulton County, especially like at our Kirkwood location, which is actually technically in the city of Atlanta. So we do serve anyone from coming out from other counties or other cities, but all of our physical locations are here in DeKalb County.
Okay. There's a question about, where is the new facility? Where will it be located?
So that's what we're working on with the
Mhm.
county to determine where best to place it. So there's been some potential properties. Ultimately, where we would like it to be is closer to a highway, and within MARTA transportation, because our current location, it's literally on a bus line, And we found that that's really helpful, and it being closer to a major highway, it just makes it more accessible for different parts of the county.
Okay. And do you have a wish list for Claratel?
Um, well, right now our wish list is getting this new crisis center built. I think right now for us, that is the biggest priority that we see for the county. Our current crisis center is 30 years old, and it has not closed its doors since it opened in 1997. So it is, we're holding it together with
Okay.
with a lot of love. And I think, having a brand new one that will let us then kind of renovate the current structure is important. Because if anything did happen to that crisis center, and we had to shut down for any reason, then not only DeKalb County, but the entire Metro Atlanta region would lose about 40% of their total crisis bed capacity. I mean, that's how much of an impact it would have if that building had to shut down for any reason.
Okay. I do have other questions. Will the new facility serve DeKalb residents?
Yes,
And, well, I guess, and also other residents?
yes.
And
So
then the other, okay, go ahead and I'll ask the other.
yeah. So as I said before, we're located in DeKalb, but we serve anyone who walks in our doors. So our current
Okay.
center, about 60% of the clients we served last year were from DeKalb County, and the rest were from surrounding counties as well.
Okay. And what are the options for those with expired insurance in terms of the amount of sessions that are available?
So if you have maximized your benefits of insurance, and generally we don't have a limit in terms of how much services you're going to see from us. It's really more so you've kind of have no more insurance coverage, and at that point we treat you as if you have no insurance, and then we'll deliver services that meet your needs and ensure that you're getting the right services. So we don't have a limit.
Okay. In regards to your youth summer camp, is that open to the public or just your clients?
Generally, what we first do is prioritize our clients that are in our Apex program, and then we will open it up to additional children in the schools that we serve. So we generally try to do that before the summer, and it really depends on how many of our clients in our Apex programs sign up, and then we'll open it up to other individuals.
Okay.
We try to have about 30 children participate in that program.
And how many weeks is that program?
The program runs about 3 weeks.
Okay. Can you provide your email address once again?
Sure, it's FABIO, V as in Victor, @claratel.org. And I'll actually put it in the chat.
Okay. Is Claratel affected by the restrictions on federal funding?
In terms of the recent restrictions.
Yes, the recent restrictions.
So right now, we do have one SAMHSA grant that was not, fortunately was not impacted. But we do receive money through Department of Behavioral Health and Developmental Disability, which they then receive federal funds. So at this point in time, those federal funds have not been impacted. So we haven't seen any disruption in our services. But then again, I say that today, I don't know what will happen tomorrow. But as of
Okay.
right now, none of our federal funding has been impacted by any of the freezes.
Okay. And do you take referrals? How do you get your clients? And do you take referrals?
We do take referrals. Obviously with going through our central access line, that's generally where most of our clients will come through. So they can call that line. I do have an outpatient director that if you email me, I can connect you. So if you want to develop a more formal relationship with organizations, we're always looking to partner with organizations because we realize that there are a lot of organizations out there that may not have the capacity to provide the services we can provide. So we're always looking at partnering and having more formal referral networks. and developing those. So definitely reach out to me if you want a formal, and in the meantime, you can refer clients to that central access line.
Okay. And as everyone knows, it's Claratel, CLARATEL.org. In
And
terms
the
of
number
website.
for central access, just so you got it, is 404-892-4646.
Okay, great. I have no more questions at this point. If anyone has a question, please get it in because we are getting close to the time. Doesn't look like you have any more questions, Fabio. But this will be available after we close out today, and you will be able to receive this presentation to the audience. Okay.
All right. Well, thank you once again, everyone. And as I
Okay.
said, please feel reach out. We're always looking ways to partner.
Okay. Well, thank you, everyone. I want to say in closing, on behalf of our director, Mr. Damon Scott of the Human Services Department, and our new CEO, Mrs. Lorraine Cochran Johnson, we want to say thank you to our audience for joining us. Thank you to our presenter for taking time out of your schedule today. And we're very happy that you could join us today. Please enjoy the rest of your afternoon. Thank you.
Very much.
Bye-bye.